This is something called a Mirena Coil or Mirena IUD. I've been getting a lot of questions and comments lately about the Mirena IUD. I counted something like 20 or more in the past year on my YouTube channel. Most of the questions that I get about Mirena and similar devices are something like, should I use it? Will Mirena help my particular bleeding or other symptoms? Is Mirena the same as progesterone? I'm Steve Goldring, the hormone pharmacist. I've earned multiple certifications in hormone replacement therapy. I also work with hundreds of hormone doctors all over the US, Canada, even the UK to help women just like you with hormone-related symptoms and risks. The Mirena IUD, or intrauterine device, is a little piece of plastic. It's impregnated with something called levonorgestrel. The idea is that an IUD is inserted into the uterus through the cervix. This is a procedure that takes just a few minutes, but it has to be done in a doctor's office. The IUD is designed to sit inside the uterus for anywhere from 5 to 8 years. During that time, the device gradually sort of leaks out that hormone that goes into your uterus and your bloodstream. The primary function of the Mirena is birth control. The manufacturer says that it's a 99% effective birth control method, which is pretty darn high. By definition, though, menopause means you've stopped having menstrual cycles, you no longer ovulate, and you don't even need to worry about getting pregnant. So why would a postmenopausal woman even want to use a Mirena Coil or IUD when she can't even get pregnant in the first place? Well, one of the lesser-known uses for Mirena is to reduce heavy menstrual periods. The hormone in Mirena has the ability to slow or stop heavy bleeding, even bleeding that happens during menopause. I posted a video a while back about vaginal bleeding in menopause. Unfortunately, it is a concern for some women. There are certain situations where, for example, estradiol levels can get a little bit too high, or a woman's uterus might be particularly sensitive to estradiol. In those cases, women can experience some spotting or what seems like even a full-on menstrual period. A little spotting here and there is usually nothing to be concerned about. In most cases, spotting resolves itself in a few days or at most a couple of weeks. But bleeding that gets heavy and lasts more than just a few days can be a very serious issue. A woman can start really losing too much blood and then be in some major trouble. Many hormone providers I work with will increase the dose of progesterone for a woman with bleeding that's gone beyond just a little bit of spotting. An adequate progesterone level in relation to estradiol is often enough to stop that bleeding. As I mentioned in my previous video, progesterone doses usually start at 100 milligrams once a day at bedtime. But often that progesterone level is simply not enough to stop the breakthrough bleeding. In that very common case, the dose can be increased 200 milligrams, maybe even 400 milligrams once a day. Increasing progesterone may not be the whole solution to vaginal bleeding, though. This is especially true when a woman has a severe progesterone intolerance. Progesterone normally helps women sleep, especially when it's given in an oral capsule form. It can reduce anxiety and produce a calm mood. It can usually help with depression. In fact, there's even a drug that's based on a progesterone metabolite. It's FDA approved for postpartum depression, those baby blues that women sometimes get after they give birth. But some women have the absolute opposite reaction to progesterone. As I talked about in my progesterone intolerance video, these women have severe anxiety and depression, so bad they may even want to end their lives. A woman with extreme progesterone intolerance, who also has serious bleeding issues, is kind of in a bit of a quandary. We can't just jack up her progesterone dose and the bleeding goes away. High estradiol levels can help a lot with hot flashes, night sweats, weight gain, mood swings, but they also can cause breast tenderness and they may lead to vaginal bleeding. Sometimes reducing the estradiol dose might be helpful, especially if those levels are on the high side. In the case of a woman who can't tolerate progesterone, but who is still having some vaginal bleeding, the Mirena IUD might be an option. But there are 4 things to keep in mind about the Mirena Coil or Mirena IUD. First, Mirena contains levonorgestrel, as I mentioned. It is not the same as progesterone. Second, Mirena will protect the uterus from endometrial overgrowth, which is a very important role of progesterone, but it's not the only role of progesterone. Because levonorgestrel is not the same as progesterone, it won't help at all with sleep, depression, or anxiety. And fourth, like many other hormone birth control options, it can lead to an increase in what's called deep venous thrombosis, a type of blood clot that could even be fatal. The risk is still low, but Mirena can increase that risk. So there are a few things that you might want to be aware of in regard to the insertion of the Mirena IUD. I had a conversation just a couple of days ago with some younger women who are relatives of mine, and one of them had the experience of having a Mirena inserted, and she said it was actually quite painful. She had heard from friends of hers who had had other types of IUDs inserted, and they had experienced similar pain upon insertion. So it's something to be aware of, and you may want to talk that over if you choose to get a Mirena IUD from your provider. You may want to talk over kind of the process and exactly what happens and how much pain people might experience. Other things that can happen after a Mirena is inserted is you can get cramping, you can have spotting or a menstrual bleeding or a vaginal bleeding of some sort. Some women have difficulty whether the Mirena was inserted and caused a lot of pain and spotting and cramping, or removed and caused some similar side effects. It is possible that a woman in menopause could theoretically take oral progesterone capsules and have a Mirena IUD inserted at the same time. The Mirena IUD could help stop vaginal bleeding. It's kind of a judgment call between you and your provider. You'd have to have a serious conversation about. I call my content simple hormones. That might be a bit ironic because hormones aren't always that simple. But what I'm trying to do is to simplify them as much as I can so that anyone can understand what's going on, even without a medical or science degree. If you're struggling with some of those complicated things that go along with menopause and hormone replacement, like bleeding, I'd love to connect you with a hormone specialist in your area. Visit my website at simplehormones.com/referral and fill out my referral request form. I'll try to steer you toward hormone practitioners who've seen it all, who know exactly what to do in any of these complicated hormone situations. I'll also include a link at the end of this video that says find a provider. Click that link and go straight to that referral request form that I mentioned. If this video has been helpful at all, click the like and subscribe buttons and be sure to ding that little bell to get notified anytime I post a new video. Thanks so much for watching, and I'll look forward to talking to you again next time.